Well, welcome everyone. I'm Mandana Khalili, Professor of Medicine, Director of the UCSF Research Coordinating Center's Investigator Development Unit of the NIMHD Health Equity Action Network. I'd like to welcome you to our monthly training webinar. Before we start, we would like to acknowledge the Ramaytush Ohlone people who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding. Our wonderful speaker, Dr. Lourdes Baezconde-Garbanati, and I apologize, my pronunciation is not the best, speak to us on communicating scientific information to various audiences to reduce health inequities. Dr. Lourdes Baezconde-Garbanati is an Associate Dean of Community Initiatives at the Keck University in California. In 2023, she was appointed by the president of the university as Distinguished Professor in Population and Public Health Sciences at the University of Southern California. She's also the Associate Director of Community Outreach and Engagement at the USC Norris Comprehensive Cancer Center and Director of the Center for Health Equity in the Americas in the Department of Population and Public Health Sciences, as well as Associate Director of the Southern California Center for Latino Health, a joint venture between USC and Children's Hospital of Los Angeles. She has worked with Hollywood, Health and Society, with the USC School of Cinema, and has had multiple multidisciplinary projects related to communication and journalism. She is also a holder of 5 academic degrees and speaks multiple languages. She's earned her MPH and PhD in public health with an emphasis on community health sciences from the University of California, Los Angeles, and holds a master's degree in medical psychology from the Universite Catholique de Louvain. She has won numerous awards and recognitions for her work both nationally and internationally, and we are incredibly lucky to have her be with us today. Dr. Baezconde-Garbanati, welcome, and please proceed with your talk.
Thank you. Thank you so much. It's a real pleasure being here. I'm going to share my screen. And Rochelle, I see your note about the video. Great. So I'll have you play it when we get there. Thank you so much. Let me see. Let me just make sure I got all this here. Are you able to see my screen there?
Yes, we are.
Okay, great.
That's perfect. Thanks.
Great. Well, thank you so much for inviting me. It's a real pleasure to be here, and I see some familiar faces, so it's wonderful to see you here, and some new people I haven't met before, which I look forward to maybe working with you in the future as well. So today I'm going to talk about how we communicate scientific information to various audiences to reduce health inequities. And as was mentioned, this is part of our Southern California Center for Latino Health, which is a joint venture between Children's Hospital Los Angeles and the USC Keck School of Medicine. And the entire program overall is under the PI-ship of Dr. Michael Gorin. So I have, I'm funded by NIH, but I have no other disclosures. This presentation in particular will focus on some of the work that we've been doing within the Latino Center, as well as some of the principles that we utilize in community engagement, as well as some of the models. Some of the strategies for communicating scientific information. And I'm going to give you examples which go beyond our Latino Center into other programs as well, just to give you a breadth of different ideas so that as you think about these issues and communicating information, that you have more of a breadth of everything that you may be thinking about or that you could potentially do. And then we'll focus on mechanisms that we utilize to raise awareness in the community with working with promotores de salud and meeting the communities where they're at, as well as ways that we're very innovative in terms of changing behaviors, and the use of storytelling and the importance of narrative in changing behaviors. And we can have the questions at the end, so it'll be about 40 minutes or so. And we have a couple of videos that I'd like to show you. They're very short, but I think they'll illustrate some of the things that we're talking about. So our Southern California Center for Latino Health has a mission to work towards the elimination of chronic health disparities in Latino and Latina and Latinx children and their families. And we do this through an equity-focused and culturally sensitive way using interventions and research. We work with 4 specific projects, one on early life, social, environmental, and nutritional determinants, another one which works with families, another is a food prescription program to promote affordable diets, utilizing promotores de salud in doing that. And a fourth is our newest project, which is a diabetes prevention program for Latinos, which combines glucose monitoring and artificial intelligence. So one of the things that I'm going to do is I'm going to talk a lot about our community engagement core, because that's where some of this work stems from, as well as other community engagement cores from other centers, including our Cancer Center, as well as our Latino Coordinating Center, which is on tobacco, and our tobacco work overall. So you'll see a few examples of that as well. Here is sort of like the key areas that we focus on our engagement core, which is supporting the center's research, promoting collaborations between stakeholders and the center, identifying successful local and community-driven strategies, and then facilitating a bidirectional academic and community partnerships, and really doing outreach into the community on a variety of areas. Our scope of activity spreads out geographically through 10 different counties in Southern California, with a very large percentage of Latinos, over 45%. So a lot of the presentations that you'll see have a gear towards the Latino population, but they are fairly universal and can be used in many different groups as well. So I'm sure you've all seen this model, which is the Health Equity Through Transform Systems for Health model from the National Academy of Medicine. And this model really helps to guide very, very overall the community engagement that we do within the center. And then we have a very specific model where we work with our CBPR, which is our community-based participatory model. And there are different models that exist for CBPR, and you could utilize different ones that may be important for you. But if we look at the first area, it looks at both social and structural context, capacity building, and readiness. It really focuses on the partnership processes and building those partnerships, and then developing interventions and research that really integrate the community knowledge and empower communities and engages them in the research. Whatever model you utilize, there are basic principles for community-based participatory research that are really essential. And I have them out here, and you will get a copy of the presentation in the future in case you would like to go back through those. But really is promoting collaborative and equitable partnerships, recognizing the community as a unit of identity and building on the strengths of that community, really facilitating the co-learning both from the investigators' part in the academy as well as from the community scientists who can also teach us a lot about their communities, and really balancing the research and action for mutual benefit of all partners, not just moving the research forward, but in what way does our research really benefit our communities? So now I'm going to look and give you some strategies that we have utilized through our different programs that we work on, not just in the coordinating center on tobacco that I mentioned, but also our Norris Comprehensive Cancer Center and our Southern California Latino Center. So one of the things that's really, really key is the importance of having a community advisory committee so that you can really establish that bidirectional input from community to the academy and from the academy to the community. So really important to engage with an advisory committee in order to get the pulse of where the community is at, understand what are some of the priorities the community might have, and which are the best ways of communicating with the community overall. And as we think about communicating with various stakeholders, we need to think about two purposes in general. One, is it just to generate awareness and provide general information, or are we really seeking to change behaviors? And either way, we need to account for a variety of factors, which are cultural factors, how culture influences any messaging that we do, literacy levels, numeracy. You'd be surprised at how many individuals in our community may not understand what a certain percentage is. But if you say, 1 out of 2, they'll understand that better than 50%, for example. Language appropriateness, and when I refer to language appropriateness, is not just a translation into a language, but utilizing the specific terminology for the group that you're working with in particular that is needed. Access to information. Do people have access to information? And what are those mechanisms that may be important for delivering information? And then what is the level of technology use, as well as what is the availability of that technology or even Wi-Fi connections in certain communities? So one mechanism that we utilize is really communicating with community advocates. We work with over 160 community-based organizations that participate in various coalitions through our various coordinating groups and center. This is a picture of our Latino Tobacco Coordinating Center, and it was at a training for advocates in particular. And here you have, including the advocates, you also have the director of the Los Angeles Department of Public Health Latino, not Latino, but the tobacco work that's being done in Los Angeles. And so we work in unison with these different partners. Also working with elected officials. Really, we are the science that can inform decision-making. And so finding ways that you can collaborate with your elected officials. And this is going to require the most specialized attention of all the audiences that we may have, because they have specific agendas that we need to keep in mind. We have challenges in terms of the content, the size of the content that what we can produce, the messaging, the format, the follow-up that is needed, and really informing the elected officials of the priorities of their community, and really, really building a relationship with the elected officials so you become, as a scientist, the source of trusted information that can then influence the policies that they are making. So we work in communicating with policy and decision makers in multiple ways. These could be anywhere from maintaining your communication through district visits all the way to legislative visits in your state, through emails, phone calls, public comment, testifying before elected officials, writing letters, op-ed pieces, meeting with them. And media coverage is really, really important as well. And so being able to find the ways that you could do that are really critical and important. Here's some pictures of our USC T course, which is all on tobacco research, but based on a lot of the work that we've done with our community partners since 2018, we've been able to provide the science behind 31 policies that have been implemented in California, both locally as well as statewide. And so that's been a really essential part of some of the work that we've done. That's been done through our Latino Coordinating Center that has produced even a policy manual for us to be able to follow and for our partners to be able to follow in achieving this. And this is a picture with the district attorney's office and some of our representatives as well during a couple of years ago. It was just a recognition of some of the work that we were doing at the policy level. In our center, it's really important to work with champions. So this is a picture of our past senator for the USC area, which now has joined since 2013 the university and currently serves as vice president for state government relations and special counsel. She is a member of our scientific advisory committee and advises us on policy. And right now we're working on thinking about how we're going to move more into that arena within our Southern California Center for Latino Health. And she has been instrumental in providing ideas of the best way to work with legislators and policymakers. Also, developing educational materials that are geared for engagement of this audience is really important. And the most important thing is keeping it brief, because at that level, you could have information that they will come to you to obtain further information, but you need to be able to put in a very brief way the key information that you want to communicate. And these are examples of executive summary briefs that we have produced in order to get the message across. Other are informational and fact-based fact sheets and infographics that you can develop based on your research that can then communicate very quickly the one or two key messages. So you don't want to expand too much, but you want to have one or two very key messages, as you see in the orange flyer, which is an infographic really giving information about some of the areas that you have been doing your research in. Also looking at geomapping. So this is a map of Santa Ana and its neighboring city of Irvine, and then the localities where more of the retailers concentrate. And you could see the areas where the Latino retailers are concentrating versus in the general community. And so this also helps to tell a story about what you're doing in your community when you could utilize geomapping as one of the mechanisms to really convey the information and geographically ground the information that is related to your research. We also have other ways of communicating information. One is through our community wellness hubs, where we distribute information directly into the community to raise awareness. So we engage in activities and a variety of things that we do, including going, for example, just last month, we had about 7 engagements at the community level where we were going out to provide information on, whatever topic of interest you could have, but certainly to promote our own research, as well as to provide vital information for the community. In May of 2023 at Plaza de la Raza, we had a viewing of a movie called El Susto, which was really geared towards a Hispanic community with some speakers that really helped to bring the message about the use of sugary beverages in the community and the impact it has had in Mexico and then an immigrant community coming into the United States. These are just a variety of examples of the work that we have been doing in the Southern California Center for Latino Health. And some of them go into working with our promotores de salud. So we have trained a series of promotores de salud that are now able to go out into the communities and really work further on some of these issues. Some of these promotores de salud range in terms of their levels of mastery and education, from someone who could have just a 5th grade education all the way to physicians who can't have not been licensed to work in the United States and are doing more health education work. And so being able to work with these promotores de salud, who are trusted individuals in the community that you can identify. And other communities have similar community health workers as well. And this is an important part of what we do and how important it is to train them and to work with them. Here is a picture during the COVID pandemic when they were going out door to door just to understand what were the needs for vaccination in those who were homebound and who were not going out, and to make sure that we could connect them to the resources necessary for them to be able to obtain the vaccinations that they needed. Also providing trainings, technical assistance, and listening sessions. So an important thing is, are you listening? Are you listening to the communities? And so through our community core, we have a series of listening sessions where we bring people together in order to really hear what are some of the areas that we need to focus on. And here, this is during one of the trainings that was led by Adriana, our guys, who is one of the lead with Nicole Wolf in our community core, which is led overall by Dr. Michelle Kipke and I. We also have different kinds of trainings. This is a training that we did on genetics, and this was with promotores de salud in a train-the-trainer model. So these are community workers that will then go and train others. This program in particular is called our CoGenes program. It's our Community Genetics Navigation Specialist program, and it's part of our Moonshot program on cancer with a focus on colorectal cancer. So we bring folks together. We train 12. They in turn have now trained others, and we have a total of 42 individuals trained. In the dissemination of their work, they have already reached through various means, including radio and other means, over 3.6 million people. And so the promotoras are just vital to getting the word out and getting the message out into our various communities. Now I'm going to turn a little bit towards the work that we've been doing in terms of storytelling. This is part of what is called edutainment, which is a combination of education and entertainment. And that is putting an entertainment value in a messaging that you have for the community. You could do it in multiple ways. You could utilize vignettes. You could tell your story or tell the why. You could use YouTube or visuals. The key is to use stories or testimonials in different ways to convey messaging. We've used different forms of doing that, and I'm going to illustrate some of that in a moment. One program that we worked on is our Stay Connected LA. This was a program that was established during the pandemic, working with 11 local Latino artists to develop public health messaging that we knew was coming out of our research, that we knew was really important in order to get people vaccinated. So I'm going to now, this is the leading images that then were displayed in the community along with a campaign. So while everybody was staying home, a lot of our Latino workers were the ones that were out in the community doing some of the basic work that was still needed and were essential workers. And so we wanted to get messaging out that was appropriate for their communities. These were displayed in the Boyle Heights community, which is part of the eastern part of Los Angeles, which is over 90% Latino. And these images went through a process of community engagement where the communities also were able to provide input into what these images look like and what they contained. And this was also enhanced with social media imaging as well. So now I'm going to move to here, and Rochelle's going to play, which is only a 1-minute video. So you could see the campaign in action and out in the community. And it was all based on the research that was being done. So we'll share the link with you and you could look at it. And it's one of the ways that we engage our Latino artists to develop this outdoor media. And then we put it out in the community. And so it conveyed messaging to the community in order to, wear masks, stay certain distance. And so we were so effective in this that we were able to get a 30% increase in the intervention communities compared to our control communities and to the rest of Los Angeles in terms of getting vaccinated in the African American and in the Latino community. This was specific for the Latino community, but we also worked on some messaging in the Latino community as well. And so, some of these things are really important and effective. Okay, other ways that we have worked on this is through developing films. The films that we develop are very short. They're usually 5 to 11 minutes. They're not like, an hour film or anything like that. And they're done really taking into account the cultural perspectives and what are some of the issues that are coming up in this. These, again, were developed during the COVID pandemic. Happy Birthday Granny up on the left was developed with an entire crew of African-American film producers and writers. And they produced out of focus groups that we had done with the data. They took that and turned it into a script and developed this film on Happy Birthday Granny, addressing the issues that came out in that community in particular. We also had a Spanish language film of Reasons and Rumors that was also developed, acknowledging what were the issues that were coming up in our research and focus groups on the vaccine hesitancy. And then we addressed that through the film. A third film that we did was Team Player. And Team Player was a film that was done for the school system. So we worked with the Department of Education in Los Angeles to develop this film, which at the beginning, the writers that were doing this, which were multicultural, produced certain segments that then we had to take out. And we took those segments out because when the Department of Education looked at them, they felt that they would not be appropriate in the younger children environment. And so, and although they could be appropriate for parents. So I'm going to show you that little clip that was taken out because I think it's just fun to see it. But before I show you that, I want to tell you that there are some key variables that when you're developing films to convey the research and the education that you need to keep in mind. One is the value of transportation. And what that means that people can be transported into the storyline. A second key variable is identification, how people identify with the issue or with one of the characters that you are portraying. And then conveying some level of emotion that is either, it could be laughter, or it could be something funny, or it could be something more dramatic. It's based on where you want to go with this. There are 3 types of characters that you'll need to include. One is a character that's very decided on whatever the issue is. Another one is the undecided character, or the one who is on the fence. And so it's the movement of that undecided character to the decided character that you want to convey. And you want to show and model how that works. So now I'm going to show you the piece that was taken out of the educational piece because it dealt with erectile dysfunction and it's tied to COVID at the time. And so, of course, it wouldn't be appropriate in the broader educational system, but it is appropriate for parents. And so we utilize this when we're trying to reach the parents themselves. So I'm going to show you this little clip.
And I got vaccinated. Not only to protect ourselves, but also my mom. And my little one, Anna. She's still too young to get the vaccine.
Hey, Coach, I hope that vaccine gave them super strength and super speed, or else we're looking at another 0 on the scoreboard.
Don't worry, we'll do just fine.
Want to make it interesting? $20 says we lose. Again.
Why would you bet against your own team? We're on the same side.
So that's a no? You scared? The vaccine make your pee-pee soft?
I'll take that bet, Robert.
Huh?
You heard me. I'll take the bet.
Just so we're clear, you're saying that you want to bet that if we lose, I would win...
$20, that is correct. But if they win, you get yourself and Ricky vaccinated.
And you'll shut up for the rest of the season.
No way, keep your money. I'm not gonna risk my manhood for a couple bucks.
You know the vaccine doesn't cause impotence.
Oh yeah? What about that guy? What's his name, from accounting?
Oh, he wasn't vaccinated. The erectile dysfunction was a side effect from actually getting COVID.
What? Nah.
I'm telling you, man, it's true. Side effects from COVID are way worse than the possible side effects from the vaccine. A New England Journal of Medicine study found that the vaccine has no effect on erectile dysfunction. However, a mild COVID infection could,
How do you know all this?
I did my research, man. I'm all vaxxed up.
So you could see that has a little bit of sense of humor in it, and it conveys an important message, which is based on research. And so this is just one example of how you could interject the research into the storytelling, having a certain value of entertainment while at the same time being informative to the public. I'm going to show you another clip, which is from our Tamale Lesson. And our Tamale Lesson is one of our signature programs. It's one of the classic programs. It was funded by NIH in order to develop messaging on cervical cancer screening. And it also is very similar in nature. It was produced in part by the same group at the USC School of Cinema, along with our public health department, as well as the Annenberg School of Communication. So I'm going to show you now a clip of our Tamale Lesson.
And I got vaccinated.
Oh.
Have you ever had a pap test?
No, I told you I'm a virgin.
Okay, it's true. You mainly get HPV from sex. But so what? You're 21 and you should get yourself checked out anyway.
Checked out for what?
A pap test?
What's a pap test?
Nothing.
Hey, I gotta know things too. I'm about to be a woman.
You're about to be 15, not quite a woman.
Petra got married when she was 15.
And I was too young. Why don't you go try on your dress?
Why are you going to have a pap test?
Pap test?
That's what they're talking about while they're making tamales. Can you believe this?
Well, every woman should know about pap tests.
Why are you perverting your sister? She doesn't need to know about those things.
Yes, she does. Do you want her to get cancer?
Who's talking about cancer?
You can get cancer down there.
Yes, but Connie's not like you. She's a virgin.
Pap tests are not just for women who have sex.
Ay!
Do you know women from 21 to 60, they should get checked at least every 2 years. And if you're sexually active, you should get checked more often. I heard 50% of the women have this virus.
That many?
Yes, and if you don't get checked, you can get cervical cancer and it can spread all over your body and you could die. You should get yourself checked, Petra.
My husband is dead. Why would I need a pap test? Who has the time or the money?
It's not that expensive. It's an easy checkup. Plus, I hear women your age.
I ain't that old.
I'm just saying, you're on the higher risk. Plus, it's very easy. You don't even have to go to a hospital. You can go to the clinic on Central, and it's free.
Does it hurt?
No, not really. Just like a mosquito bite like this.
Ow. It's embarrassing.
And it's probably uncomfortable.
No, it's more like this. Okay, when you go to the doctor, you sit on the table, and they spread your legs like this.
Stop. And what exactly does the doctor do?
Okay, so let's pretend this is your vagina.
It's not that color.
Hi, Petra, just pretend.
Okay, I'm a tamal.
So the doctor has like this device, this metal device. They just spread the walls of your vagina.
I don't say words like that. Petra, you've never had this test done before? It's not as bad as it looks. Mira. They take this mascara type wand and then they just rub you on the inside like that.
They take a little sample of your cells.
What if you still have bleeding down there? Ay, mija, are you still having that problem?
And that's all?
Yeah.
You find out right away if you have a problem?
No. Usually, I don't know, it takes like, well, you do the test and then they send it to the lab and you probably get the results like in a week or two.
Too much salt. Put in some sugar.
Hey, Petra, you should get checked.
At our age, I don't think we still need to. Besides, we're not having sex. Speak for yourself.
So I'm going to stop it there, but we have a 3-minute clip and then we have a 11-minute film of the Tamale Lesson, which is one of our signature programs. And so one of the most interesting things is how we tie this to the research. So if you could see in this graph, the gray below is the number of people who had already had a PAP and were not due for a PAP in an experiment we did with about 1,000 women. And what you see here essentially is how people either had a PAP since they viewed the film or made an appointment within the 6 months follow-up, really helping to eliminate a disparity that existed at baseline. And so this Tamale Lesson was produced with a sort of the background of 12 focus groups that we conducted. And then we developed the script. And Josefina Lopez, who is the producer of Real Women Have Curves, she came up with the script for us. And then it addressed all the barriers, all the issues. So everything you hear in the text and in the script is really based on the focus groups that were done within our program. We are also now toying with the use of artificial intelligence and trying to figure out what's next in this arena. And I want to play you just this so that this was in May. Just recently, I was at a meeting at the Moores Cancer Center, and this is the future. This is where we're at today. I just want to play you a small segment of this.
How can I help, you wonder? From assisting patients with personalized care to supporting the amazing staff here, I'm all about making cancer care smarter and more empathetic. I can manage patients' emotional health and well-being, conduct, pre- and post-care training, and free up the healthcare team's availability for patients.
So you could see that the promise of AI, even with the caveats and the ethical issues that we would need to have, is very promising for some of the work that we could do. Already, we're experimenting with different ways of using AI, including for translation purposes, as we could have the availability of translations in up to 38 different languages. Why is that important for us in Los Angeles? Because of the large diversity, over 140 languages are spoken in the Los Angeles School District alone. And so to be able to reach all of these various communities in different ways, we're trying to explore the ways that AI can facilitate and help us. It's really extraordinary to see these robots in operation, and they're getting more and more humanoid each day. So it's kind of scary in some ways, but just really exciting about the potential possibilities. Although, again, I say there are issues that we need to address as well in terms of the use of AI. So pretty much I'm going to stop here because I want to leave ample time for questions. But the key is to know your audience and to be very creative in the way that you do your research and in how you communicate your science to the community. So whether you're communicating science to community stakeholders, to the population at large, to policymakers, or just educating community health workers to be able for them to communicate additional messaging. These are multiple ways in which you can get the information out about your science. And so we're very excited about, going beyond the simple publication. Well, it's not that simple. I know it takes time and you don't always get it accepted. And that certainly is the first unit because you will be evaluated on your publications. But there are all these other ways that you could work with the community, that you could engage the community in many aspects, if not all aspects of your research, if appropriate. One thing that we're working on now is how do we engage community with our basic science programs and those conducting, the basic science, so we could really have that path from cell to society. And it's really, really exciting thinking of and working with them and meeting with some of the basic scientists so that they also understand what are the priorities within our catchment area, which includes 10 different counties for our Southern California Latino Health Center. So I hope that this has been informative and has given you just a little bit of a snapshot and the breadth. And I can certainly meet with any of you also separately so that we could address some of these areas that might be of potential interest. And with that, I'm going to stop now and turn it back to our host, and we'll see about any questions.
Thank you so much, Dr. Baezconde-Garbanati. We really enjoyed your presentation, and thank you for sharing the various messages to us so incredibly and visually. We've received a tremendous number of comments about how amazing this has been and your work, and quite impressive. Dr. Katz has asked, there was a lot of comments about our Tamale lesson. It was wonderful to watch it. She's asked whether or not you can share with us where this lesson was shared and how long was the whole video.
Sure. So the Tamale lesson, which, like I mentioned, is one of our signature programs. Right now, we're working on updating it because the guidelines have changed since when we produced it. And so we need to make sure that the guidelines for screening are incorporated into the text, which proves to be, a little bit more challenging because we don't have access to the actors anymore. And so now we're trying to figure out how do we put in the new guidelines in a different way. So we're trying to figure that out. But the Tamale lesson was shared with 800 different clinics throughout California through the National Hispanic Medical Association, which then would play this in their waiting rooms, while women were waiting for other issues as well, and then really encouraging people to make an appointment. It also, we took it internationally because I did some work in Panama. I do a lot of global work as well. And in Panama, we work with the Ministry of Health of Panama, and it was being utilized in 900 jurisdictions throughout Panama. And what's exciting about that is not just that it went globally, but that it went into very rural communities where community workers, promotores de salud, were utilizing the video to train women in the community. Then we tied it to the resources in the community and the availability of being able to get Pap test or DNA testing or other kinds of mechanisms by which the women could have, their screening. And so that was really exciting because it had a far, far outreach beyond what we even expected originally.
Thank you. Amazing work. There was a question about, or maybe a comment about getting at the cross-generational questions and thoughts. Could you comment a little bit more about, I know that there was a number of focus groups to really center the video or the presentations to what are the common issues potentially experienced. But can you comment a little bit more on how that was achieved?
Sure. So again, we looked at, through our focus group, we interviewed people in different age groups just to make sure that we have that piece. But I want to tell you something. I don't tend to say this very frequently, but I will tell you that although it was perfect and it was so wonderful for the Hispanic Latino community and the Mexican American community in particular, it was also universally tested with African Americans and with non-Hispanic whites, and it worked beautifully. But it bombed in the Korean community. So I want to tell you about that. So this is the stuff you don't see in journals. So the reason why it bombed was precisely what you're talking about, Dr. Cahill, that it was the people couldn't see themselves in that situation in particular, because there was a generational gap. And what would happen is in the Korean community, through focus groups, we learned later that the older women would be the ones giving the messaging, not the younger women. And it wouldn't happen in that kind of a scenario. It would happen in a much more private scenario than in a more, kind of all the whole family, everybody together talking about this. And so we had to use a fact-based film that we had produced, which then we utilized for the Korean community, and it worked out beautifully. And so, so really understanding not just the generational differences, but also the cultural nuances, and each, you have to kind of adapt to that and know that it's not one size fits all by no means, and that we need to really take into account what each community really needs and how they respond to things.
Wonderful. We have some comments or questions regarding the resources and the cost and some of the work that goes behind really creating such impactful products. Can you give us some information about those aspects?
Sure. So we had funding from a transformative R01 through the NCI Director's Office. And that funding was for a much larger grant, that this was just a small aspect of it. The grant was like $3 million for a variety of things, including the focus groups, the evaluation, the testing, the development. The actual development was probably maybe about 130,000, which paid the actors, paid also the the film crew that was going to do the filming, and a little bit towards the production value of a lot of it. So, but now with AI, you could produce much cheaper types of film and other kinds of communication. And we have now toyed in different things. The other campaign I showed you, the Stay Connected campaign, where the video didn't play, but that you could look it up. That one only cost us like $30,000, because for that, we just utilized social media, and then we used outdoor media. So it could range between, very limited amounts of dollars that you can get through an extension grant, even within, or a supplement grant, to something more massive. And, there are different ways that you could do that. You could do testimonials, or you could do very short clips. And so depending on how long you need to produce this messaging, but to produce the actual films, one thing we find is that they shouldn't be shorter than 5 minutes. And the reason why is because, remember the characters I mentioned? You need to get someone from being undecided or not wanting to do this to move to action. And you need to have that process, and that process takes a little bit of time as you play out the video. And so in order to change behavior, you could raise awareness within the first 30 seconds, and you can increase knowledge within a minute probably. But for actual behavior change, it takes a little bit longer to get that messaging in, absorbed, and integrated into a person.
So important what you just shared. Thank you for that. I'm wondering, the AI aspect is amazing, and that's really food for thought, and I'm sure it's generating a lot of ideas. How close do you think we are to that implementation? And I can only imagine not only reaching the various communities would be within reach that way, but also in what you just shared about changes in practices and also recommendations over time. One can potentially envision being implemented much easier through the process of AI. Would you mind giving us a bit more information on that?
I fear we're already there.
We are already there. Fantastic.
We're already there. And this is where transformative groups are really important, and what we call transdisciplinary research, where you are not just bringing different folks together, but really bringing people to create something new and a fusion of ideas that's more like a chemical reaction, something that explodes, and it's just like incredible in terms of the research. because like many of us may not have the AI skills that others are acquiring at this moment and that are really so we have our Institute for Creative Technology, for example, at USC is way beyond anything that, that we could be thinking about. Incorporating AI into some of the work and the research. For example, in our center, David Black, which is our fourth project, is incorporating the use of AI into the delivery of messaging for diabetes and for glucose monitoring. And so there's all of these other aspects that are happening as we speak. And the key is if you don't have the skills, but you know of others and you find out of others through team science that can bring those skills together, you could produce some of the most innovative research as well as engagement and outreach of the populations that you're working with.
Wonderful. Maybe to extend on that, how receptive is the community to AI or having a robot sort of explaining things to them?
Sure. So I think it depends on how you do it, I think that, and also age differences, the younger generations, I think they're born with some kind of chip that you just go boop and they immediately get it. I mean, I've had my 14-year-old nephew explain things to me, but which I didn't understand. And so it depends on your age group. I think that with the older generations, it may take a little bit longer to get them to understand that. And I think that that cannot be done without the human aspect of it and someone that's engaging on, with the individuals in this. I think we need to understand where people are at in terms of the use of technology. I know that in our Hispanic population, for example, we're really good about texting. So if there's maybe a way that, you could utilize a text feature with some AI messaging that could be generated. Some of the things that I know that AI is being used for now is to develop these first drafts of different things so that you don't stop there. I mean, it would be too dry and probably culturally not, grounded in any way, but that could be a first creative draft that then you could work on for some of the things that you want to do. So we're working with different population groups to understand what is that, acceptance. But, we're like seeing that this is just happening all around us and we don't want to stay too far behind. And so experimenting with in what ways we could do it. And certainly one way we found is a translation. There's another way that I was hearing about just last week is how AI has been producing animated videos in animation so that if you don't want to use a person per se, you could use more animation type of work that could convey the messaging. And that may be less kind of, difficult to accept than seeing somebody that looks just like you but has yellow eyes, So we have to just be creative. And I really encourage, especially our young investigators that are probably more versed on this than I am, to think about mechanisms in which you can integrate AI into your research.
Absolutely. Thank you for that. I'd like to see if there's any additional questions that anyone would like to ask in person. Dr. Katz, would you want to just ask your question in person?
Sure. Hi, and thank you so much for this presentation. Not a doctor either way, just FYI. don't want to take that title.
Sorry.
No, it's okay. I was asking about in terms of production. So I know USC obviously has access to, production, these kinds of materials and actors and things like that. And I'm curious if you just have suggestions or advice on the kind of tools and production materials one might need, or if you suggest going with some sort of production company that has experience with this, especially thinking about smaller budgets and things like that.
Well, since most of us are tied to universities. Most universities, especially in the undergraduate programs and in the, arts, letters, arts and sciences divisions have either cinema schools or schools that are oriented in this direction. So that would be a first selection. what are the resources that might be available for you. The production companies can get expensive. We have tapped into those as well. But, for example, for one of our materials that we produced, we actually had a faculty member that was looking for a topic to address and have the students work on a project. And so we were able to be the project that they worked on. And this was for our Es Tiempo campaign that I didn't talk about now, but it's the use of the jacaranda tree, which is this beautiful purple tree, as a reminder to get messaging out about cervical cancer as well, which is a lot of my own research. And for that, it was a class that they took us and adopted us. And then they were in the School of Cinema and Letters, Arts, and Sciences. And then they worked with us on doing that. So there are also independent contractors that can help you do this. And to tell you the truth, some of the actors in some of these things were our own students and our own staff. So sometimes we do pay, like Petra, she is a paid actress, but some of the others that participated were, we just kind of had to have them work with the people that were doing the production. So I think that there are many ways and that you could, approach this so that you can keep the cost down in terms of doing that. But I would look to your own institutions to see if they have people that are already versed in that, rather than you trying to learn all of this, But they're really good. I'll just give you one example of how good they are. In the Tamale Lesson, we produced it in an English version and a Spanish version. And the Spanish version, they needed to look at what the mouth looked like when you said certain words. And so, for example, the family that was in the film, they wanted the family to be called La Familia Martinez. And if you could see my mouth, Martinez, but the production in English said Oliver. And so they had to find a word that was more like O than, than ma. And so they are so good. They pay attention even to that level of detail to have a higher production value. And that's really authentic for your community.
Amazing. Thank you again. Go ahead. Sorry, Ariana.
Oh, no, I was just saying thank you. Thank you so much.
Wonderful. Well, I think our time is unfortunately up. Dr. Baezconde-Garbanati, thank you so much for this outstanding presentation and really sharing all the various experiences and challenges and successes with your program with us. And we have all been motivated and I'm sure very much excited to continue this type of work in the future as well. Thank you again.
Thank you. Thank you, everybody.
Wonderful.
Bye.
Bye-bye.